I am Ernest Nadal, and I am a thoracic oncologist at the Catalan Institute of Oncology in Barcelona. There are many challenges, but I could comment a couple. One of them is the difficulties in having the appropriate testing rate that we should do the genomic diagnostic in certain tumors, because it's crucial to deliver the best therapy. Now we cannot start a therapy if we don't have all this information, and that is one limitation, because not everybody has access to these technologies. Other important challenge is the access to the therapies, that not all the European countries are getting access to the same therapies on the same time. And for example, Spain, we are a bit behind other European countries. I think clinical research is helping us to incorporate innovation, and is allowing some patients to get access to these therapies, but still there is an important gap. Then I think we need to reduce this gap between the innovative diagnostic tools and the innovative medicine, that is medicines that are already on clinical trials, or even they already demonstrated benefit, and we need to get all these advances closer to the patients. And me as an oncologist, I am very concerned. We work hard to have sometimes research protocols could help us to get closer this innovation to the patients when they are not yet approved. But it's true that we need to think in other approaches, and we should be creative to try to find other ways to get this innovation closer to the patients. Yeah, I think it's important to increase cooperation in Europe. There are some countries that are more advanced than others, and we need to learn from others to get the opportunity to generate the ecosystem and to share the knowledge that we accumulated during the last years to increase the access to this innovation. For example, we are participating in an European project to generate novel panels of liquid biopsy. That at this moment we have some panels in the market, but they are really expensive. But it will be nice to have alternative panels that could be affordable by a public health system. Then I think this kind of cooperative projects could be important to try to reduce these gaps that we were commenting. And it's really challenging, because in systems that in Spain that we have a public health system, it's difficult to afford everything. But we need to convince our authorities that if we have better diagnosis and better treatments, we will increase quality of life and the life of our citizens. But on the other hand, it's true that it's very difficult, because the innovation is going so fast, and there are so many medicines that it's difficult to incorporate all this innovation in a short period of time. Then I think the meetings like we are having today, or projects to cooperate and to join forces, is the way to go. Yeah, I think it's fundamental, it's crucial, because it's a good framework to share knowledge and initiatives and cooperate between us. And there are some countries behind. I think the countries that are more advanced, particularly in Europe, that we have this philosophy of cooperation. I think it would be nice to work together to get those that are behind in a different scenario in a few years, and those that are above, maybe they could get access to other innovation that they could also share with other countries. I think there are countries, for example, from the east of Europe, that they are really behind the current access to the current standard of care, and this is something that is not acceptable. I think we need to work together to have a more equitable access to innovation in all the countries.